Okay, Mr. Hartman. Let me tell you what I'm thinking based on the tests we've done so far and what needs to be done next.
Doc, did the CAT scan show what's causing my headache?
No, but unfortunately CAT scans don't show everything, particularly the things I'm most concerned about. The good news is there are no signs of increased pressure, at least for now.
So what are the things you are concerned about?
Well, with severe headache coming on so suddenly in a healthy guy, I'm concerned that you may have had a small bleed in your brain. We call those subarachnoid hemorrhages. And those represent an area of weakness in one of the blood vessels around your brain, kind of like a bubble on an inner tube tire. And if that's the case, the neurosurgeons are going to need to go in and put a clip on that area to prevent any further bleeding.
That sounds serious.
It is, and I have to tell you that sometimes it can be fatal. So it's really important we find out what's going on.
How are you going to do that?
Well, the first thing we need to do is what's called a spinal tap. There's a fluid that surrounds your brain that connects to the lower part of your back where your spinal cord is. And we can go into that area, into the spinal canal area, and get some fluid out of that. It's much safer than going into the brain area. If there is bleeding, we should either see some red blood cells or at least some chemicals that come from those cells breaking down.
Could it be anything else?
Well, the other thing I would be most concerned about would be meningitis, which is an infection of the coverings of the brain. Actually, the spinal tap is also the best way to make that diagnosis. That fluid should have some white blood cells or pus cells in it. Sometimes we even see bacteria. So the spinal tap is the best way to go to rule out both of the things I'm concerned about. And if we rule those out, then we can relax a little bit.
What does a spiral tap involve? Is it dangerous?
Well, it's actually a spinal tap, and we call it a lumbar puncture. That's the medical term. We would kind of lie you on your back as you are now and put some numbing medicine in and around your low back and go between two of your vertebrae and obtain some fluid out of there. Sometimes we can see red blood cells right away that would indicate bleeding, but in any case we would send the fluid to the lab where they can look more closely and do the necessary tests.
But is it dangerous? What are the risks?
There are risks with every procedure. The most common thing we see with this procedure is a severe headache. But you're a guy who already is having a severe headache, and I don't think it's going to make it any worse. There's a very slight chance that some bleeding can occur around the spinal cord where we insert the needle. And that usually is much more common in people that are on blood thinners or other medications, and you're not on those. And then anytime we introduce a needle into the body, there's a chance of infection. But we use very careful sterile techniques, so that is highly unlikely also.
Is there anything else that we could do?
Well, if the spinal tap is positive for blood, then we're going to need to do what's called a cerebral angiogram. That's where they take dye and shoot it in the arteries of your brain and then take some x-rays to identify the area of bleeding. Well, that's obviously much more expensive and has many more risks than a spinal tap. So I think the spinal tap is the way to go.
Well, will my insurance cover it?
Absolutely.
It's going to hurt, right?
Well, we're going to numb the area of your low back, but it still involves a big needle. It should only take a few minutes to do, though. So do you feel ready to sign a consent?
Yeah.
Do you understand what we want to do and why?
Yeah.
Have I answered all your questions about risks?
Yeah, I guess. You really think we should do this?
It would be very wrong not to. I need you to read this and sign it for me, sir. Can you see it okay?
Yeah.